So now comes the very, very important T of tarantula. Sorry, I know I just said tarantula of this spider remedy. Please, everyone, please write this down. Please write this down. Please, this is, or take a snapshot of this. Very, very important phrase. Tension, yes, all the time, tension. Tantrum, anger, nitric acid, phod dega, phek dega, I will remove things. Anacardium, throw things. Nakswamika, violent anger. As if a Rottweiler is on you, you know. Tingling numbness, yes, all these peripheral neuropathies are seen. I'm using my dad's laptop. I just hope no program starts, you know. Tantrum, tingling, tremor. Now, can you tell me which conditions tremor is there? Srishti, I read clinical medicine regularly. I always believe that a good doctor, a homeopath, is a combination of mental state. Yes, it's important, but also clinical medicine. But unfortunately, there are some people, you know, some students who lay importance only on mental state, and they don't give importance to the clinical findings, the tongue, the hard facts. So a good prescription or a good doctor is the one who takes into account everything and amalgamates everything to give a good prescription. So if you prescribe only on mind, and if you give only mental based prescriptions, I don't think you will get a good result. A good doctor is one who knows clinical medicine very well. Please remember, friends, the doctors of the 17th, 18th century, all the European. So my question was that when a person of tremor comes to you, what is a different diagnosis? Dr. Saima Undre says dystonia. Yeah, dystonia is right. Parkinson disease, cerebral tremors, very important. Don't forget, tremors because of thyroid disorders also, hyperthyroidism also can give tremors, which is more common. That's Saima gives it. Myasthenia gravis will be more of weakness, weakness which gets aggravated with work. Myasthenia gravis patient, as he keeps on working, the energy comes down. And opposite is the Lambert-Eaton syndrome. Lambert-Eaton syndrome, where a person, as he starts working, his energy will become better and better. That's the Eaton-Lambert syndrome. Fatigue, yes, fatigue is important. Also, intentional tremors of no reason, idiopathic, are important. Alcoholic tremors, please don't forget alcoholic tremors. Rajni is asking, what is tick? Tick. This is tick. Okay, this is tick. Tick, titubation, titillations. Now, clinically, this remedy are very good for tumors, tremors, eczema, and septic fevers. There's only one remedy, which is the antidote, and which is Ledum Pal. And Ledum Pal, incidentally, also shares some Matra Medica along with Arenia diadema, which you see now that for punctured wound, it is very important. Now, I'm showing you something which my teacher, Ajit Kulkarni, has exhibited in his wonderful lecture. Ajit sir, thank you for this. So look at this, how the entire spider is put on one paper. We have necrosis, seen more in the Hasseltine and also in the humans, ulcerations, inflammations. We have anxiety and hysteria. I told you about hysteria. The person has emotional imbalance, hysteria. The time passes too quickly. Yes, I think I missed it out. Time passes too quickly. Thermally chilly, glandular affection, discharges, the respiratory and the hypersensitive, selfishness, sexuality, activity, industriousness, destructive, and region. Please capture this screen. I think this summarizes our discussion till now.
So, Namaste from Mumbai. I am Dr. Gaurang, based in Mumbai. So, we have just recently started the course on classical homeopathy. This is a 7-month course. It's a weekend online course, one of its kind, with close to about 20 global homeopaths teaching so much in depth about organon, materia medica, repertory, that I would want to invite every single homeopath there for this course. You can join anytime. It would be 120 hours. It would be only weekends. and the recordings would be available for 1 year, so you will get to see the videos again and again close to 1 year. So that would be a major advantage for any homeopathic student who is either studying homeopathy in college or an intern or a practitioner. There is something for everyone. Once you join the course, you also become part of one of the WhatsApp groups, one of the top WhatsApp homeopathic groups, or a top group that we have curated, where we'll be putting up a case every week and you will be solving cases. So this solving cases helps a lot. Now almost close to 50 cases we have put gradually. We are going to be putting, and you can solve it. That's a very special thing that you could do. Not just about organon, materia medica and repertory, we'll also talk so much about different approaches. You're treating cases of acutes, how we can treat cases of currently acute COVID, how we are using remedies like streptococcinum, pyrogenium, influenzinum in today's acutes, how we are using the remedy China, for example. Today I saw a case, chills begin from back. One of the top remedies, Eupatorium perfoliatum. So these kind of very important kind of clinical indication. We will also talk about other approaches, how to treat hormonal cases. Here in my clinic in Mumbai, you can see this is my clinic. We are treating many PCOD cases, thyroid cases, endometriosis cases. What is the approach? How I use sarcodes, how I use nosodes, how to use organ specific remedies, how to use backflower remedies, how to use star of betel, how to use biochemics in today's time with cough and cold, little dullness, malaise, whitish discoloration of discharge, tongue white, calimuriaticum 6x, how we are using it. So there are so many different approaches we are going to be talking, and that is why with open arms I want to invite every single one of you. You can join, be a part of us. There are close to 650 doctors who have already joined, and we have a limit of 900 seats for now. So you can write to us, write to me. There will be an entire email ID with all the details of the course below. You can write gaurang@gmail.com, and it would be so good to study with you. Namaste.